Welcome to this short video explaining the coding and documentation for major depressive disorder, a risk-adjusted diagnosis. This means that MDD is listed as a valid condition in the CMS HCC payment model. In our experience, MDD is a frequently reported diagnosis that usually does not have the required support in the medical record or progress note. First, let's look at the required criteria of the MDD diagnosis. The criteria for diagnosing major depressive disorder, or MDD, come from the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders 5th edition, or DSM-5. As you can see on this slide, in order for the patient to qualify as having MDD, the clinician must document at least 5 symptoms experienced by the patient nearly every day for at least 2 weeks. That is the key and the source of the improper coding of this condition. 9 symptoms are listed here, and the symptoms correspond to the Patient Health Questionnaire, or PHQ-9, which we'll look at on the next slide. By the way, if you would like to receive a free copy of our bulletin on major depressive disorder, simply click the contact button on our website, click anywhere on this slide, or send an email to info@askccg.com. On this slide, you can see a partial PHQ-9 document, which you can find online or download from our website as a PDF. The PHQ-9 has the same criteria we just looked at from the DSM-5, but they're written in a language more easily understandable by the patient. In some practices, a staff member asks the questions of the patient, and in others, the patients might answer the questions for themselves. On the next slide, we'll look at an actual PHQ-9 completed by an anonymous individual. Here are the PHQ-9 questions from a popular EMR system. As you can see, the questions also correspond to the DSM-5, and the answer given by the patient is denoted with a check mark. The PHQ-9 is then scored, and as you see here, the score leads the clinician to conclude the patient has moderate depression. In most cases, if this is the first time the patient has had these symptoms, the provider might select the code F32.1, Major Depressive Disorder, Single Episode Moderate. If this was a second or subsequent episode of this type of symptoms for the patient, the provider could choose code F33.1, Major Depressive Disorder Recurrent Moderate. But both of these would be incorrect. Remember that the DSM-5 says these symptoms have to be experienced by the patient nearly every day. As you see here, that is not the case. This patient's PHQ-9 does not support a diagnosis of MDD, and the 2 codes I mentioned would be incorrect. Remember that meeting the 5 criteria constitutes an episode of major depressive disorder. Thankfully, episodes don't last forever. Eventually, most patients respond to treatment and their symptoms resolve. When the patient's symptoms are less than the full criteria, or it has been less than 2 months since the episode, the codes for partial remission might be indicated. Once the patient's symptoms are completely resolved, or it has been 2 months since the last episode, the clinician can code MDD in full remission if appropriate. It's critical to keep in mind that if the patient never met the criteria for MDD to begin with, he or she can't be considered to have MDD in remission. Every practice should have a compliance program where you validate billing episodes and risk-adjusted conditions. We suggest you conduct a small review of your MDD patients to determine whether all the codes are well supported, as we've discussed in this video. Start with a small sample And if you find mistakes in the documentation or coding, expand your sample accordingly and conduct re-education of your providers and coding staff. Our company would be happy to help you with a small validation audit, and you can also feel free to request our bulletin on major depressive disorder. If you have any questions or comments, please don't hesitate to call our office.